Thank you very much. I want to thank all of you for being here and participating and supporting. Just your presence and your sincere enthusiasm and support for this is really important, and it actually means a lot to me. So I have an amazing panel to work with today, and we're going to really try to get into the meats, the heart of some insights into not only just the overall role and potential of community, but how the institution and academia partner with community. And I really, before I begin, I want to just talk about that last comment in the workforce and creating jobs, because it's really important to me. You know, I am an academic, but what hasn't been spoken a little bit, not too much today, is those of us who've crossed over, who've come from the communities that we're talking about helping and actually made it up through the ranks and hierarchy of academia to leadership positions in places now that, like me, have an ability to impact and help pull more people with me. I came from the bottom 1% in Detroit, and I was told a whole lot before I got to college what I couldn't do. And then I was told a lot about during college experience of what I couldn't do as well and what I couldn't be. I was told I didn't have a rat's chance in hell, and that's a direct quote of getting into medical school and becoming a doctor. So thinking about that, what really helped me is an example that's been threaded throughout today, and that was what Manuel Pastor started with, is the students who had the opportunity to really reach out and engage in their community and help organize and lead. Well, once I started organizing the Latino students at the University of Chicago and leading them, I had more of a voice, and I was able to move up, and it really was important to me to be able to do that work because it has influenced everything I've done thereafter. And so with my lived experience, I can bridge that world. And I think it's really important that we also think about all of that talent that we're talking about harnessing for community organizing, but getting it over to the academic side. I want to see more people like me and from places where I grew up on the academic side so that I can work, and not only me, but so that we can work with communities from which we came from and help empower us. Because we know that physicians who come from underrepresented minority groups from research, we know that they tend to work more in communities from where they came. Same thing with researchers and community-engaged research and community-based participatory research. We know, and everybody's shaking their heads. So the workforce development and changing the architecture of the pathways of developing the talent in our communities and bringing them over to academic side so that we have talent on both sides and true partnership and engaged dialogue on both sides helps shift that ecosystem and move it forward in a positive direction to impact population health. Because it's that workforce development that helps us really get back to equity and eliminating health disparities, which is central to really true population health. So with that, I'd like to ask one more time to please hold your questions to the end. I'm going to have each speaker speak for 20 minutes, and then you're going to get a warning, right? The 5-minute and 1-minute warning. And then I'm going to ask, so we'll have one panelist at a time. The first panelist is Jamela Watson-Thompson. Dr. Watson-Thompson is an assistant professor in the Department of Applied Behavioral Sciences and the Associate Director for Community Participation and Research and the KU Work Group for Community Health and the Development at the University of Kansas. Thank you.